Hi friends, welcome to this new video. Thanks for joining me. Today in this video we will be discussing a new set of 10 MCQs and also we'll try to solve them, so please stay with me. Our first MCQ of this video is the following statements or statement is or are true regarding intravenous mode of drug administration. So options are there. Intravenous route is suitable for irritating substances. It is ideal for high molecular weight peptide drugs. C option is unsuitable for oily substances. The D option is requires strict aseptic techniques. And finally, all of the options are true. So actually the correct answer to this MCQ is E. All of the above are true. So now moving on to the next MCQ. The following is or are considered to be topical dosage form: patches, eye drops, air solutions, nasal drops, and E is all of the above. So actually we know that all these dosage forms are actually come under the category of topical route. So the correct answer is E. Now the third MCQ, the main mechanism of absorption from GIT for exceptionally large size molecules of drug moieties is or are. Options are passive diffusion, facilitated diffusion, active transport, endocytosis, and both C and D. In this MCQ we are actually asked about the mechanism of absorption for large molecules of drugs. So the correct answer is actually endocytosis. This is actually the only process through which exceptionally large size molecules of drugs are absorbed. Now the fourth MCQ, vitamin B12 is absorbed from the GIT by one of the following mechanisms: passive diffusion, facilitated diffusion, active transport, endocytosis, any of the above. Actually, vitamin B12 is an exceptionally large size molecule, as in the previous MCQ we have discussed. So, for the absorption of such exceptionally large size molecules, we know from the previous MCQ, the answer is endocytosis. It is through endocytosis that vitamin B12, which is an exceptionally large size molecule, it is absorbed from the GIT. So vitamin B12 is absorbed from the GIT through endocytosis. Now moving on to the fifth MCQ of this video, all of the following factors may affect the absorption of drugs except pH of the environment, contact time at absorption surface, perfusion of absorption site, expression of P-glycoprotein, or none of the above. So actually in this MCQ we are asked about the factors that may affect the absorption of drugs. So we know that pH of the environment can affect the absorption of drugs, as at certain pH the drug will ionize. So if it ionizes, then it will be hard for it to be absorbed in its ionized form. So at another pH, this ionized form is not so much there. The drug is in its intact form, so it will be easily absorbed. So pH of the environment definitely affects the absorption of drugs. Now the B option, contact time at absorption surface. We know that more the contact time of the drug at the absorption surface, more chances for absorption will be there. So definitely this is also one of the factors, that is contact time, that will affect the absorption of drug. Now C option is perfusion of absorption site. Perfusion means blood supply at the absorption site. We know that more blood supply is there at a site, so more chances of absorption will be there. So this option is also there, that will affect the drug absorption. Now the D option is expression of P-glycoprotein. Actually these glycoproteins, when they are there at a certain place, the drug absorption will not occur so much. So when they are expressed in a large number, then at that tissue the drug absorption will not be so much, and thus the drug absorption is affected. So all these factors will affect the absorption of drugs. So actually the correct option is none of the above. Now moving on to the 6th MCQ, the recommended daily amount RDA of vitamin B12 for adults is, now these options are there, 2.4 micrograms, 240 micrograms, 500 micrograms, 1000 micrograms, and 2000 micrograms. Now actually we know that the recommended daily amount of vitamin B12 for adults is 2.4 micrograms. This much amount of vitamin B12 we need on a daily basis in our food. Now the 7th MCQ, the injectable form of vitamin B12 that is are used to treat deficiency of this vitamin is hydroxycobalamin, adenosylcobalamin, cyanocobalamin, methylcobalamin, or methylcobalamin, and the E option is both B and D. Now the correct answer to this MCQ is hydroxycobalamin. Now the 8th MCQ of this video, if 50 mg of drug is given orally and only 30 mg of it reaches the blood in unchanged form, then its bioavailability will be. Actually, to calculate this calculation problem of bioavailability, we can actually use the formula of, let's calculate this on the calculator. We know that only 30 mg reached the blood out of 50. So we will calculate this here as 30 mg has reached into the blood out of 50. Now to calculate the percent bioavailability, we will multiply this by 100, and the answer comes as 60. So this is the answer. Actually we calculated this as 30 mg reaches the blood out of 50 mg. So in 100 mg how much it will reach. So we multiply this by 100 and we get 60. So its bioavailability will be 60%. So now you know the answer to this question. Now the 9th MCQ, bioavailability can be determined as, it is actually the formula for bioavailability. If you know that, then you will immediately answer this question. So options are there: area under the curve AUC oral divided by area under the curve IV. That is area under the curve for oral route divided by area under the curve for IV route, and so on. The options are there. Actually the correct answer in this is AUC oral divided by AUC IV multiplied by 100. So this is the correct answer. Now moving on to the last MCQ of this video. Drugs having the following chemical nature will effectively cross biological barriers and spaces, thus reaching their target site. In this MCQ we are asked about the properties of the drugs that actually make it easier for the drugs to move across the biological barriers. So option A is very hydrophilic, meaning that if the drug is very hydrophilic, it will effectively cross biological barriers. Or it is very lipophilic. Or the C option, largely lipophilic and some hydrophilicity is there. D, largely hydrophilic and some lipophilicity is there. E, equally hydrophilic and lipophilic. Now we know that the ideal drug should have actually these properties. It should be largely lipophilic, while to some degree also it should be hydrophilic. Lipophilic means that it has lipid solubility, and hydrophilic means that it has water solubility. So if these properties are there in a drug molecule, then it will effectively cross biological barriers in our bodies. So this is the correct option. So this was all for now. Thank you friends for watching, and please subscribe to my channel if you would like to get notified for more upcoming such videos. And one thing more friends, if you have any confusion or any question, or if you want me to explain some point, then please do notify me in the comment section, and I will respond to that as to the best of my ability. So thank you once again for watching. Thank you.